within his blood. So if the child presented with a sign and symptom of nephrotic syndrome, and after renal biopsy, it shows that it is minimal changes that cause that nephrotic syndrome. So that child will not be more vulnerable to infection, since the child is having his normal serum immunoglobulin, but it's only losing serum albumin. Since what happened in minimal changes is only selective proteinuria. I hope you get me. What I mean by selective proteinuria, only albuminuria that occur, but no immunoglobinuria. So put that in your mind. So after that, we also have hypercoagulable states. The patient with the patient with a nephrotic syndrome will be in hypercoagulable state. Another name for hypercoagulable state is what? Thrombophilia. What I mean by hypercoagulable state, the patient will be more vulnerable to thrombosis. The patient will be more likely to have arterial and venous thrombosis within his body. Why? Because the patient has urinary loss of antithrombin 3, protein C, and protein S, which are anticoagulant. So since he's lost this 3 anticoagulant protein, so the patient will be more vulnerable to body thrombosis. Have you getting me? So also the patient with minimal changes will also lose certain nutrients within his body. What I mean by nutrient, I mean macronutrients, macro element, which include what? Which include iron, copper, and zinc. So the patient will have iron deficiency, will likely to develop iron deficiency anemia. You can see the patient with nephrotic syndrome with iron deficiency anemia. Why? Because the patient lost transport protein of iron within his urine. What is the protein that carry? What is the protein? What is the name of protein that transport iron within the blood? It's what? Transferrin. So the patient loses transferrin within his urine. So the patient will have iron deficiency anemia. The patient loses ceruloplasmin, which is a transporter of copper within his blood. So the patient will have copper deficiency. Also, the patient will have zinc deficiency. So, and so on. So the patient, you will see, the patient with nephrotic syndrome was what? Was a macro element deficiency.